So I gave you little snippets of what I was doing over the last week. But to be honest, when I got home from my trainings in the evening times, the last thing I wanted to do was to go onto Instagram and tell you all what it's all about, because I kind of felt I needed to get the trainings complete, get it sorted in my head, compartmentalize them, because there were a couple of different trainings, and to be able to consolidate it, because it's a melting pot, and I understand it's a melting pot. It's even a melting pot for me, so I can understand why the likes of the regular client who comes to my door who would say, Olive, I don't know what to ask for. All I want is an improvement in my face. So the trainings over the last week has been all aesthetic trainings. It's got nothing to do with the eyebrows. So, and as you know, here in Clonakilty, I have been doing injectable skin boosters for the last year. It's been an industry that's actually growing. It's exponentially grown for me. I didn't expect it to grow in the fashion that it did, but I think I'm the only nurse west of Innishannon, west of Cork probably, who's actually delivering these treatments to the women here in West Cork and Kerry and so on. So and I was doing the skin boosters, trained initially with the gold standard, which was Bellaterra Revive. It lasts 6 to 9 months once you've had a minimum of 2 treatments. Then moved on to Profilo, which is a 2-step process as well, but probably doesn't last as long. The clients were coming to me and saying to me, so what else can you do for me, Olive, when they see that gorgeous injectable glow? So I make no secret of the fact that I am 60 years old, and it's only in the last 2 to 3 years that I've really properly taken care of my skin. I was in Belfast for the last couple of days, and I've noticed that the women that we treated there were younger, so clearly they maybe start younger. I think they become mothers younger in the Northern Ireland, and then their children are all grown up and now they have money for themselves. So I had noticed that women in my clinic were saying, so what else can you do for me now that I've given them a skin booster and they've seen the beauty of it, and they come back every 6 to 9 months depending on which one they've had. So I needed to upskill and masterclass in extra areas. So as you know, I did a class on the perioral lines. So these are the purse string or barcode lines that we get above the lip, but you can also get them below here also. And if you get if you have lines here and here without them being a proper fold per se, I wanted to treat this area because that is rather aging. And then after that, what's aging, I suppose, is crow's feet, but I love my crow's feet, so that doesn't really bother me. And after that is the neck. So I'm going to tell you about the trainings that I did over the last couple of days, what I've had done myself, which I did. I had something done myself. And I'll tell you and be as transparent and open as is possible. I'm an open book anyway. And all I can say is that the trainings were wonderful, but what's available to you as a client is... And as you know, part of that class that I did way back in June of this year was the perioral lines at the basic level. And I did the advanced masterclass in Belfast, and I didn't have any work done on my periorals on this occasion because the opportunity didn't arise, but I will be having it done very soon. So each little line can be entered from the side 5 or 6 times. Yes, the upper part of your lip is sore. The lower part is less sore, but each injection site is sore. But we give you numbing cream, and we will also give you a ice pack. So the most important thing for you to know is that they can be erased with injectables. And there were 8 models that came in to have their perioral lines. So perioral is above the lip, below the lip, and at the side of the lips. So that's a specific area, and it's separate to cheeks, it's separate to forehead, it's separate to under eye, separate to neck and décolletage. So it's an area all by its own. And the injector who taught us was really patient with all of us, and I was absolutely delighted when I saw the results of my client. So my particular patient is this lady. This is her before, and this is her after I had finished with her. And the injection technique, because I literally did the line all the way, not only as far as her lip, but it went down as far as here and here. And she had to keep on pursing like that so that I could erase all the lines. Here she is. So if this is something that interests you, I have bucket loads of product in, and I'm getting more and more inquiries about the periorals. And what had actually happened was a lot of the women were saying to me, "Oh my God, I'm have a gorgeous glow here now, but these periorals are starting to cheese me off." So now it's great. So once you have them injected, it's a lunchtime treatment. You're a little bit swollen, maybe about 20% swollen for maybe 4 to 6 hours afterwards. And it's usually gone down in 24 hours. You might be able to feel it underneath maybe for about a week or so, but it's not visible. So when you're cleaning your face, you can actually kind of feel the little blebs, and that slowly dissipates. And a lot of the women who are clients of mine have been saying, "Oh my God, I'm going to ask my husband to get me that now for Christmas." So happy women. So as you know, last Friday, which was this day last week, I went to the Aesthetics Medical Conference in the RDS, which was organised by Dr. Patrick Tracy. And the whole focus at that time on that particular day was regenerative medicine, which is the future, exosomes, polynucleotides, and so on. And that is the future of regenerative medicine, aesthetics, cosmetics, and so on. So I had already signed up to do a course with Regen, which is PRP, which is platelet-rich plasma. Now, if you're confused, I can understand this, but just park the whole cosmetic thing now that I did with the periorals, because this is a totally different area of cosmetic aesthetics. It's usually used for sports medicine, but it's come now to the fore for that certain clientele. So our trainer on the day was Dr. Ryan Haman. He is based in the UK. He operates a clinic called Botched. So he tries to undo a lot of the work that have been done by practitioners in the past that's now considered a botched job. So he does a lot of reversal, tries to do the reversal, and he has noticed that PRP, which is the platelet-rich plasma, is now replacing a lot of, say, the likes of tear trough fillers. Like, say, if you had hollows underneath your eyes here, hyaluronic acid used to be injected in there in the last 20 years. And now as women get older, the hollow gets bigger, their face probably falls south a little bit, and then that blob of hyaluronic acid is visible there. So he was expounding about the advantages of PRP. And for me, who wants to go down the road of the regenerative injectables, and the entry level obviously is to do PRP. So I did that training. It was such an intensive day. So basically the basis of it is that I take 10 mils of blood from your arm. If that's just for regular PRP, I'll explain that in a minute. Or if you want your blood to be mixed with hyaluronic acid, which is called a cellular matrix, that is hyaluronic acid that is commonly known as, well, I use Bellaterra Revive or the likes of Profilo or Galderma, whoever. So your platelet-rich plasma is mixed in with hyaluronic acid. So that is kind of a bit of a double whammy. It's kind of like that 200% dose of hyaluronic acid. goodness that's re-injected into your face. Sorry, I have a kitty who's looking for attention. So that hyaluronic acid is already in the tube, so there's no fiddling. It's all taken from your own blood, put into a vial, put into a centrifuge. The machine is on its way. I think I should have it today. And you're left with, out of your 10 mils of blood, you're left with 7 whole mils of this platelet-rich plasma, PRP, or if you want to go for the extra boost, which is it with hyaluronic acid, which is re-injected back into your face. So you can do cheeks, you can do marionette lines. You've seen Jennifer Rock have it done. You can have it done under your eyes. You can have it done on your eyelids, your forehead, neck. I'm going to talk to you about that now. Décolletage, backs of hands, anywhere in the body, because it's your own plasma. So the PRP can be used in the hair, the scalp. I'll talk to you about that in a second. Anywhere in the face, all around the eye area. So eyes is actually a very difficult area to inject, or a sensitive area. Dangerous could be a word that would be used. But with the PRP, it's your own product. So you're putting it back in, and it's rich in growth factors. So what it does is stimulates the elastin and collagen in that area, and particularly if you're getting some lax crepiness around your eye and orbital region. Anybody who is tired or doesn't want to have Botox or toxin in this area anymore, it's lovely to soften out these crow's feet lines. Obviously it can be used in your nasolabials, it can be used in your marionette, anywhere in the body actually, because it's your own product. I think I've said that already. So while your blood is spinning in the centrifuge, which only takes 5 minutes, topical anesthetic is applied to the areas that you particularly want to have it injected into to give you that lovely injectable glow. And that man that we had in the previous snap, he had no topical put on, and he had nasolabial folds, he had fanning done along here, he had some work done here, and he also had his orbital area done. Now he happened to be one of the trainers, and the lady who owns the business, he does too, had said, right, Tony, onto the couch with you, and you can, because you were so fast to tell all the women, oh, it's only a little sting. So he had it done, and there wasn't a flinch out of him, and he had no topical. So it was fine. So I can send you the information pack out in relation to PRP. A lot of the questions that came in over the last couple of days was how often do you need to come? So it's recommended that you come for a minimum of 3 visits, 4 weeks apart. And then after that, then it is every 6 months to maintain that lovely glow. One of the things that stood out for me, just besides the fact of what it can do for your face, your neck, your décolleté, backs of hands, we did all those injectables, was a lady who lost all of her hair in COVID 2 years ago. Was really ill and in hospital for 10 days and came home. She said she was never going to die. She knew she was very sick. And within 2 weeks of coming home, all of her hair fell out, as in she was bald. So this is her 2 years later. So while we were waiting for her blood to be spun in the centrifuge, I was asking her about her story, and her story is actually kind of something like I'm hearing a lot of in my clinic from the eyebrows point of view, because a lot of the people who got COVID before the vaccine obviously got a fairly hefty dose of COVID. And there is a condition called telogen effluvium, which you can lose, is whereby you lose your hair after a traumatic event in your life, whereby your blood supply goes to the areas that needs it the most, and the hair and nails usually are the last to get the blood supply, and you can lose your hair temporarily and it can come back. She told me that a year down after losing all of her hair, her doctor was kind of shrugging his shoulders and said, I don't know what we're going to do for you. You really need to invest in a wig. And she did that for a year. Incredibly attractive lady, clearly took care of herself, and she, when because all of us, there was 10 of us at the training, all of us got to inject her scalp. And we were all sort of, oh, I'm really sorry, because you can't numb the scalp. And she was saying, guys, just do what you need to do. This has brought my hair back. I started this a year ago. I had 4 sessions, 4 weeks apart. And today is my maintenance, and I'm happy to be a model for ye because look at my hair. So she now has a full head of hair, albeit thin, but she's now not wearing a wig. So I'm just going to put a behind shot here so that you can see. And I'm nearly more excited for the PRP for those kind of clients, because I meet them in my clinic because they've lost brows too. So I got notification this morning to say that my PRP centrifuge is on its way with fast ray couriers. It was dispatched in Ireland this morning at 6 o'clock. So I'm waiting for the notification for it to be delivered. And this weekend, even though I'm not in clinic, I'm going to bring it home, and I have 5 willing parties to have their faces, necks and hair, scalp over the weekend. So even though I'm actually not working in clinic this weekend, I'm going to be working very hard here at home in the home clinic here. So I'm going to be setting up a home clinic this weekend, and yeah, I'm dying to just get stuck in. And even though I saw how fabulous the hair growth was of that lady, I want to see it for myself and one of my own clients. Anyway, so, and further training in Dublin